Right now, the infection levels across the country are the worst we've seen. Nearly 223,000 new cases reported Wednesday, according to our own NBC News data. The COVID tracking project also showing hospitalizations are near 107,000, and the number of daily deaths topping 3,000 for the first time yesterday. The death toll in the U.S. now more than 291,000. Former CDC Director Dr. Tom Frieden saying on Twitter, if I were to tweet once every hour the name of an American killed by COVID, it would take 33 years to honor every person we have lost so far. In Arizona, 90% of the ICU and hospital beds are occupied. And this week, total deaths in that state top 7,000. NBC News correspondent Steve Patterson is in Phoenix. Steve, coronavirus cases are putting a strain on Arizona's healthcare system, but there is one hospital, St. Luke's Medical Center, that is completely empty, no patients. What is going on there?
Well, it's a bit of irony, actually, Allison. This hospital shut down last year in 2019 because of this reason, because they weren't drawing enough patients. Think about that. Now the state is bursting at the seams with COVID patients. They need help literally all over the state. And now the hospital may reopen because it's being seen as sort of a last resort. It is what's called a warm site, which is essentially health officials see it as a way to quickly spool up in the event that the state reaches full capacity and there are simply no beds anywhere. They could reopen this in about 7 to 14 days, offering another 235 beds for what they call post-acute care. That is people that are still sick with COVID, sick enough to be in the hospital, not receiving the top-level care, but not yet well enough to go home at that point. So that's what that facility would be used for. They still, again, see it as a last resort. They want to do anything before they put people in that hospital. It is unlicensed at this point, so they like to use some of the care providers that they've contracted with over the last few months. But again, it is so bad. The numbers are trending very heavily to make it seem like capacity is only probably about a week away. In fact, the largest health provider in the state says that they will be at 100% capacity by next week at 125%. Just a few days after that. The crisis is reaching levels that we have not seen yet in this pandemic. And here in Arizona, it's getting pretty dire. Back to you.
Oh, Steve, that is some scary stuff. But there is potentially space for more patients. Healthcare workers, though, telling you that they have some concerns. What have they been saying?
So, yeah, the concerns are I think, what you're alluding to. Space for more patients is great. They're looking everywhere, all across the state, to try to come up with more beds. The problem is, even if they find more beds, beds don't treat patients. Beds are just, spaces to house patients. And while that is necessary, they need specialists. You need nurses, you need doctors, you need nurses and doctors that are specifically trained to handle ICU equipment, trained in intubation. And right now there's, alongside a crisis in capacity, there's also a crisis in staffing. That is what physicians, doctors, nurses are most concerned about at this point. Help is not on the way because the crisis is everywhere. So you can't pull from other states. You can't pull from other health systems within the state. You're really out on your own. And that makes it very difficult when the ratios are so overwhelming with so many patients flooding into ERs and ICUs and COVID wings. I spoke to a physician about that and about what they're seeing on the ground here in Arizona. Here's what he told me.
It's probably worse than it was this summer because this summer, at least we had resources to draw upon from around the country because, in the summer we were one of the few hot spots, and now the whole country is a hot spot. It's not just about the number of beds available, but it's about staffed beds because you need nurses, you need doctors, you need hospital staff to actually be there. And we're running out of that not only in Arizona, but around the country.
Meanwhile, the heads of most every major health provider in the state met yesterday. They held a conference call. One of the things they wanted to put out there was the demand to the governor and the state to do more, institute a statewide mask mandate, institute a curfew, ban indoor dining. Those precautions have not been taken yet. They'd like to see that happen so they can help stop or at least slow down the spread here in Arizona, which is, again, running rampant. Allison.
Can certainly understand that. Steve Patterson in Arizona, thank you so much.
Thanks.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here. And click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.